Feverfew is a flowering plant of the Asteraceae family. Its name comes from the Latin word meaning fever reducer. Traditionally, it was used to treat fevers and other inflammatory conditions. In fact, some people call it medieval aspirin. Feverfew contains a variety of active compounds, such as flavonoids and volatile oils. However, its main compound of interest is parotenoid, which is found in the plant's leaves. Studies show the parotenoid might be behind most of the potential health benefits of the feverfew. For centuries, people have used it to treat migraines. Migraines are moderate to severe headaches that affect one side of the head. They're typically accompanied by throbbing, pulsating, or pounding pain. In test tube studies, compounds in the feverfew, such as the parotenoid and tanitin, help to stop the production of prostaglandins, which are molecules that promote inflammation. Other test tube studies show the parotenoid might inhibit the serotonin receptors, preventing blood platelets from releasing inflammatory molecules, stopping the blood vessels in the brain from widening, and stopping the smooth muscle spasms. All of these factors have been linked to migraines. In a review of 6 studies with a total of 561 people, 4 studies found the feverfew helped to reduce the frequency and the intensity of the migraines, while 2 studies found no effect. Additionally, the 4 studies that reported a beneficial effect showed it was only slightly more effective than a placebo. For instance, in a study on 170 participants, those who were taking the feverfew experienced only 0.6 fewer migraines per month than the people in the placebo group. Based on the current research, the feverfew appears to be only slightly effective against migraines. Test tube studies show the compounds in the feverfew might inhibit certain cancer cells. The anti-inflammatory properties of feverfew might help to relieve pain. In studies in mice, feverfew helped reduce symptoms of anxiety and depression. However, human studies on this topic are unavailable. Topical creams containing feverfew extract might help to treat acne rosacea by reducing inflammation. The parotenoid can irritate the skin, so this is why it's removed from topical creams. Feverfew is generally considered safe, with few reported side effects. However, studies have only looked into the short-term effect on the body. The long-term effect, longer than 4 months, has not been studied. In some cases, feverfew might cause side effects like stomach aches, heartburn, diarrhea, constipation, nausea, dizziness, tiredness, and menstrual changes. Pregnant women should avoid taking feverfew as it can cause early contractions. Research to ensure that it's safe for breastfeeding women is also unavailable. People with allergies to ragweed and other related plants from the Asteraceae or Compositae plant family, such as daisies, marigolds, and chrysanthemums, should also avoid it. It's best to first consult a doctor, as the supplement can interact with certain drugs, particularly blood thinners and liver medication. As of now, there's no official recommended dose for feverfew. However, studies find taking 100 to 300 milligrams of a feverfew supplement containing 0.2 to 0.4% parotenoid between 1 to 4 times a day might treat migraine headaches. Feverfew is also available as a fluid extract or a tincture, and this is typically used to relieve arthritis. It can also be taken as a tea, which is available in health food stores. Feverfew is commonly used as a natural treatment for migraines, yet current research shows it's only slightly more effective than a placebo. More human studies are needed to determine the correct dose. Feverfew has also been linked to pain relief, anti-cancer properties, improved mood, and reduced acne. For more on herbs, supplements, and natural treatment plans, check out my website.